Overactive bladder is a term that we use to describe bladder symptoms, which can include urinary frequency, urinary urgency, with or without urgency incontinence, which is the leaking of urine on the way to the toilet with a very strong urge to empty the bladder. There are several conservative management approaches that we can use to help improve the symptoms of overactive bladder. First, we often ask the woman to complete a bladder diary for a 24-hour period. She's asked to begin documenting information when she first arises from bed for the day. Each time she voids or empties her bladder, she writes down in one column the number of ounces voided associated with the time of voiding. In another column, she documents the time she has something to drink and notes what she drank and how many ounces she drank, such as 4 ounces of milk or 6 ounces of water. The completed diary is then reviewed and evaluated. Some women are drinking too little fluid, and some women are drinking too much fluid. If a woman is drinking too little fluid, her urine can become concentrated, and this can irritate the bladder. A lot of women have heard they should drink at least 64 ounces of fluid a day, or 8 8-ounce glasses. There is no science behind this recommendation. Aiming for about 48 ounces, or 6 8-ounce glasses a day is a good goal. If a woman is bothered by getting up more than once at night to void, avoiding fluids 3 to 4 hours prior to bedtime can be helpful. Certain foods and fluids can also irritate the bladder, and if these are avoided, it can be quite helpful to improve the symptoms of overactive bladder. The most common bladder irritants include caffeine, including coffee and tea, soda, carbonated water, alcohol, artificial sweeteners, acidic drinks, and spicy foods. We also recommend avoiding decaf products, as the chemicals used to decaffeinate can irritate the bladder. Usually, the irritants need to be removed from the diet for about 2 weeks to know if it will be helpful. Strengthening the pelvic floor muscles or doing Kegel exercises can also be very helpful to reduce overactive bladder symptoms. We begin with examining the woman to be sure she can contract the correct muscles and to assess the strength of that contraction. With that information, we're then able to give her a specialized, individualized exercise program to work on at home. As she progresses with the program and the strength of the muscles increases, she can learn urge suppression techniques. That technique can help her get to the toilet with fewer leaks. She can also use urge suppression techniques to decrease the number of times she voids during the day. If these initial conservative measures are not helpful enough, we can consider other treatments.